Have you seen those people that had stroke in your village 5 years ago, 7 years ago, and even up till now, they are still walking one kind, one kind. It's as if they can never recover again. Before I tell you if there is hope for them, I want to tell you two things that could have caused it. Number one, when they had the stroke, they rushed them to the traditional center. That is number one. I've spoken a lot about traditional centers and the harm they are doing to us in the society. But it's possible also that they didn't even rush them anywhere. Or some of them went to the hospital, and just like the one that just happened in the hospital where I work, the person was rushed there and the BP was over 200, over the higher number was over 200, the lower number was over 100. By the time they stayed there for 3 days, the hospital was able to at least to some level manage the BP. The BP was coming down. It hadn't come down completely, but it was coming down. You know what the family and the caregivers did? They carried the patient out and took him to traditional center. They felt like the hospital was wasting their time. That kind of case now, that patient will stay there, and if God has mercy on them, the BP finally comes down. And now that patient is going to stay there, and for after many months, he won't be able to walk well. You'll now see the patient 5 years later, he's still walking like this. Of course, the traditionalists, they are going to lie. They will say, we healed that person, we healed that person. Tell them to show you who they healed and show you how the person was before they healed the person. So it's a very serious thing. So those people you see in your villages like that, it's likely that happen. Now the question is there hope for them? Can they be cured? Can they know how to? Can they eventually recover from walking, from stroke? I think it's possible. I think it's possible, but it's very, very tough and demanding. Why? Because when it comes to stroke, there is a 3 months window period for best recovery. For best recovery from stroke, 3 months window period. That means that after that 3 months, the recovery is going to be slow. So the first 3 months matters. Immediately a stroke happens, make sure you start physiotherapy immediately. Even if the patient is in the ICU, we are trained to be able to see patients even in the ICU as physiotherapists. I understand some doctors didn't have physiotherapy in their school, in their training institutions. So they don't know the courses that we do. They don't know our scope of practice. But you can do well to educate yourself. But we are trained to even, we know what to do to patients that are in the ICU to keep their SpO2 good, to maintain the physiological properties of their muscles, and they prevent complications in their joints, in their muscles, prevent atrophying of the muscles, all manner of things. We know what to do. So from the ICU, you're supposed to start seeing the physiotherapist up until when the patient is discharged. Yep. So if you do that, the chances of recovery from stroke is very high and faster. So that guy that has had stroke for 10 years and is like that, he can benefit from physiotherapy, but his expectation should be low and the speed of recovery is going to be slow.